Unit 1, Introduction to the Pharmacology course. So these are your objectives. Please make sure to read them. All your unit objectives will be in the first page of your outlines. These are your reading assignments. I do highly recommend that you read them. That said, I know you guys are busy, so if for some reason you really don't have time to read this chapter, don't worry about it. I will provide everything that you need to know to succeed in this course in the outlines. So that's just here in case you need to do your more research, you want to know more, you want to get more details about the topics that we're talking about, and then, feel free to read these chapters. So, Unit 1 lecture outline. First, let's talk about pharmacology. So, what is pharmacology? Well, pharmacology is a branch in medicine that basically deals with medications or drugs, right? So, it deals with the interaction of drugs with the systems and the processes of living animals, in particular, the mechanism of drug action as well as the therapeutic and other uses of the drug. One thing that you will hear over and over for the duration of this program would be your 8 rights of medication administration. So I'm already telling you now, please memorize the 8 rights. You will see it often in quizzes and exams, and you will continue to see it again for the duration of the course, whether it's in clinic or your other courses. And make sure that when you're studying or trying to remember them, that make sure you're remembering the specific terminology that we're using. Anyhow, so the 8 rights of medication administration include the right patient, right drug, right dose, right route, right time and frequency, right documentation, right reason, and right response. So what exactly are the 8 rights of medication administration? Well, the 8 rights of medication administration are the things that we check as nurses to make sure that we are ensuring the patient's safety. And so, right patient. Well, this is pretty straightforward. When we're giving a medication to somebody, right, we want to make sure that we're giving it to the specific person that we're supposed to give it. Let's say you're giving a medication for Mr. Smith, right? Make sure that you're checking, and that's actually Mr. Smith. The way to do that is really to check for their name and date of birth. So that's the most common way to identify our patients. Now, depending on your facility, you may have different identifiers, but most places will ask nurses to verify the patient's name and date of birth. And sometimes I know the patients get a little bit annoyed because every time we ask, we do something, every time before giving the medication, even though they've been our patient for the past how many days, we still have to check and make sure that that's the right patient by checking their name and date of birth. Now, right drug. We need to make sure that we're giving the right medication to the patient. So again, before we give a medication, we have to check and ensure that that's actually what's ordered for this specific patient. Right dose. Now, it doesn't matter if it's the right medication if you're not giving the correct amount of drug. Again, depending on what you're giving, right? If you don't give enough of the drug, then it's not going to be effective. You're not going to accomplish what you're trying to accomplish by giving a medication that's not sufficient for that patient. Now, on the other hand, you don't want to give too much either because that can cause toxicity. So again, as nurses, we need to make sure that we're giving the right amount of drug to our patient. Next would be right route. So right route is basically where are we going to give the medication, right? Is it going to be something through their mouth? Is it going to be something that they have to swallow? Is it going to be an injection, an intramuscular injection, right? A subcutaneous injection. So we need to make sure that it's given to the appropriate route, because depending on what medication it is, right, it may not be effective, right, if we're not giving it in the correct route, or sometimes even worse, if we give it in the incorrect route, it can be very toxic and it can cause some problems for our patients. Next would be right time and frequency. So this is pretty straightforward. So this is when a doctor orders, right? If a doctor orders to give a medication every day, we have to ensure that it's given once a day, right? Or every day. Now, if the order is twice a day, and let's say we give it 3 times a day, then that's not safe for the patient. So again, this is ensuring that we're following and we're giving the medication at the appropriate time and at the appropriate frequency. Let's say we're giving it 3 times a day, right? But unfortunately, we're not following the correct frequency. So if it says 3 times a day, maybe every 8 hours, but we're giving it every 4 hours, right? We're not following the appropriate frequency. So again, as nurses, it's our responsibility to make sure that we're giving the drugs within the time frame specified. Right documentation. Well, this is as nurses, documenting, writing down, or noting. Now we use computer systems, right? The electronic medical records, but this is when we document what we did for our patient. And usually that also includes our assessment findings, why we gave the medication, right? It documents basically what the medication is, dose, the route, the frequency, the education that we gave to our patient. And it also includes going back and evaluating if the patient developed any adverse reactions. Now, documentation is very important because it allows us to communicate to the next nurse that, let's say we gave that medication. Let's say we didn't document, right? How is the next nurse gonna know that we actually gave the medication? So it is, again, it ensures that it ensures patient safety. So let's say you did not document that you give a medication, and the incoming nurse comes in and sees that the medication was not given, right? And then they give the medication. But what if you actually gave it, but you did not document, right? So now the patient gets double the medication. So now we're overdosing a patient. So that's not really safe for our patient. So again, it's a means of communication, but also it helps ensure safety. Right reason. So regardless of what we know about the medication, we need to make sure that we're giving the drug for the appropriate reason. So an example that I often use is, let's say, acetaminophen or Tylenol. This medication, as most of you know, can be used for fever and pain. But let's say your doctor ordered this medication to address the patient's pain, and maybe an hour later, right? Once after you receive the order, the patient develops a fever. Although you know that that medication is used for fever, you can't just automatically give it to the patient. You have to verify, you have to obtain the order from the physician. Again, we need to make sure that we're giving the drug for the appropriate reason. Now, last but not the least would be the right response. So this ensures that we go back and check on our patients after administering the medication. So right response is meaning if we give a drug, we need to evaluate the patient and ask, right, did the drug do what it's supposed to do? So an example is, again, acetaminophen or Tylenol. If you give a medication for fever, right, you check the temperature of the patient before giving, and you notice that the patient had a fever, and you had the order for Tylenol or acetaminophen. You get the medication, you check everything, and you gave the medication. Well, our task, right, does not stop there. So depending on the medication and the route, we need to go back, maybe for this specific drug, acetaminophen, 30 minutes to an hour later, and see if the patient responded how the patient is supposed to respond. Or basically, did they respond as expected? Did the drug lower the temperature of the patient? Or was it not effective at all? Or another thing is, did the patient develop any adverse reaction from the drug? So after giving the medication, this ensures that as nurses, we go back and evaluate our patient to make sure that they are having the right response for that specific drug. As nurses, we have to have an idea of how drugs make it to the market, right? How do they make it available to the public? Well, there are steps to make sure that these drugs are safe for the public. So you have the preclinical investigation, and then you have the clinical phases of investigational drug studies. So in the United States, how we basically make drugs available to the public starts with preclinical investigation. So this is when they're making research studies, investigating the drug without trialing it to people, right? Now, next step, right, and once they do all their research, their investigation, and they say, okay, well, this seems to be safe for the public, then they start their clinical phases. So the clinical phases starts with clinical phase 1. So phase 1 involves testing on healthy individuals. So an example would be, let's say they're trying to release a blood pressure medication to the market. And so in phase 1, what they're going to do is basically test the drug to healthy individuals, meaning these patients don't have any disease processes, they don't really necessarily have hypotension or hypertension. They're just giving it to healthy individuals. Now in phase 2, they are gonna get some volunteers, a small number of volunteers that have the disease. So in our specific example, this would be patients who have hypertension. After phase 2, then we go on with phase 3, which is is very similar, but includes a larger number of individuals with the disease, and oftentimes they include a control group. So meaning it's a controlled study wherein some patients or some participants will receive the drug and the other people will not receive the drug. Now, in phase 4, this study is done after the drug is released. So let's say everything was good from phase 1 to phase 3. There's no adverse reaction. There's no safety concerns when it comes to this drug, and it's actually doing what it's expected to do. Then they're going to go to phase 4. They're going to release the drug. And then after that, over time, they're going to go back and do some studies based on the responses of patients after the drug has been released. So depending on the outcome, sometimes they may need to pull the medication out of the market. So sometimes that's why you see all these commercials on TV that, let's say, if you've ever taken this drug, please call whatever, because sometimes after the drug has been released, then they find out, let's say, that medication causes cancer, then they may have to pull it out. And usually, depending on the situation, it may lead to litigations. Now, talking about litigations or legalities of it, there are some legal considerations when it comes to medications or drugs. Some organizations that you have to know are the FDA and the DEA. So FDA is the Food and Drug Administration. So they are responsible for approving drugs for clinical safety and efficacy before they are brought to the market. So they are the one responsible, or they're the ones controlling what drugs are okay to release to the public. Now, Drug Enforcement Agency or DEA, they are basically more concentrated on the controlled substances, basically the substances that tend to be abused or overuse. Again, they monitor the prescription, the use, and the dispensing of controlled substances. Now, let's not forget about the individual state law. So depending on where you decide to practice, then you may have different regulations that you may have to follow. In our specific case, we have to follow our California state laws. Let's briefly talk about the Controlled Substances Act of 1970. So this is basically a regulation that was established to ensure that controlled substances are more under controlled and monitored. So this provides more strict control and establishes the schedules for controlled substances. So what are the controlled substances? So these are drugs that have a high potential for abuse and addiction. Now, they have to make sure that these drugs, right, are being used for their medical benefit and they're not being abused. Again, what are we worried about here is the dependence, whether it's physical or psychological dependence, and sometimes, well, most of the times, these drugs can also cause withdrawal, right? Especially if they abruptly stop that medication. We're going to talk about the different schedules of drugs, and depending on the schedule, there are some regulations and specific policies that we have to ensure that we're following as nurses. And also, so the control of the substances just is based on their abuse and addiction potential. So it's from low to high, and again, based on their medical benefit. So for prescribing requirements, the most commonly prescribed controlled substances would be the ones under Schedule C2. So in here, there's no need to have written written prescription. So depending on where you are, there are some states that require patients to have a physical copy of the prescription. But nowadays, at least in California, they do accept the electronic prescription of the Schedule 2. Back in the day, they only accepted the written prescription for Schedule 2 substances. Now, laws and regulations vary state by state, but generally speaking, the Category 1, this is only with approval for protocol. So again, this is very limited, and you don't get to really administer it often. You don't see it often, just because it's usually given based on a protocol. Now, Schedule 2, again, these are most commonly seen or prescribed. So these are your codeine, hydrocodone, morphine, and hydromorphone. So in here, written prescription is required in some states, but not in California. There's usually no refills and must have a warning label, basically potential for abuse and so on. Now you have Schedule 3 or Category 3, which are either written or oral prescriptions. They usually expire in 6 months. You're not allowed to have more than 5 refills in a 6-month period. And again, they must have a warning label. So examples would be your Tylenol number 3, which is acetaminophen with codeine. And basically, these are commonly medications that are combined or mixed with codeine. Now, Schedule 4 or Category 4 will have written or oral prescription that expires in 6 months. There's no more than 5 refills in a 6-month period and must have a warning label. So these medications usually are your anxiolytics or medications to help treat with anxiety. Examples of this would be your phenobarbital, benzodiazepines such as your lorazepam, alprazolam, and diazepam. Again, for these specific ones, the most common ones that we see are Schedule 2, followed by Schedule 4. Now we have Schedule 5, which is requiring written, and some of them can be an over-the-counter medication depending on the state laws. Example would be cough medications and antidiarrheals. The reason for that is some antidiarrheals contain opioids, and also some cough medications tend to be abused. So for testing purposes, no Category 2 and Category 4. Brand names and generic names. So brand names are basically the trademark or trade name or proprietary name of a drug. So these are assigned by the pharmaceutical companies marketing the drug. So usually they have similar names. They have names that are easy to remember and easier to pronounce compared to the generic names. Now the generic names, these are the names given to a drug by the United States Adopted Names Council. So this is also called the non-proprietary name or generic. So the generic name is much shorter and simpler than the chemical name, but it's still more difficult to remember, pronounce, or write compared to the brand name. And this is not protected by a trademark. So what you will notice is that drugs may have multiple brand names, but it should only have one generic name. So again, generic names are assigned by the U.S. Adopted Name Council, and there's one per drug, and usually it describes the active ingredient or chemical component of the drug. Drug classification. So classification of drugs, oftentimes you will hear prescriptions, over-the-counter, or herbal supplements. Now, prescriptions, over-the-counter, and herbal products vary, although some medications usually start as they would start as prescription, and over time they make it and they change it into over-the-counter versions or classifications. So let's first talk about prescription drugs. So for prescription drugs, it means that an order is required in order to obtain this medication. So this allows a provider to control the drugs, to make sure that the patients are not just getting or taking the drugs without proper monitoring. So again, in prescription medication, it allows more control, making sure that it's appropriate dose, and they also limit the number of drugs or the number of medications being dispensed. So it enables the healthcare worker or prescriber to guide the appropriate treatment and patient education. It allows them to monitor or limit the side effects of medication. So examples of these drugs include your blood pressure medication, which include lisinopril and metoprolol, and clopidogrel is a platelet aggregation inhibitor, which you will learn down the line. Now, next would be your over-the-counter medications or OTC. So over-the-counter medication do not require any prescription or ordered. Now, that said, let's say if it's an over-the-counter drug and a patient gets admitted to the hospital setting, to the acute care setting, in the inpatient setting, they will still need to have an order to continue taking whatever over-the-counter drugs that they're taking, just to make sure we don't get any interactions. But generally speaking, right, as an outpatient, this do not need any order or prescription. So there's actually benefits to having over-the-counter drugs. Generally speaking, over-the-counter medications are low risk for abuse. They're much safer. They don't tend to have very dangerous or frequent side effects or adverse reactions, and most of the time they're actually lower cost. Now, potential problems, not because they're over-the-counter medications that they don't get to be abused. Sometimes they still get abused, whether knowingly or unknowingly. The problem with over-the-counter medication is that some people take medication without the appropriate knowledge. So sometimes they choose the drugs, right, when it's actually a drug that they're not supposed to take. So an example of that would be, let's say, ibuprofen. So ibuprofen is generally safe for patients. That said, ibuprofen can be very toxic to the kidneys. Let's say you have a patient with renal failure or kidney failure, right? They don't know any better and they start taking ibuprofen because their knee started to hurt, right? So that may actually cause more damage. So again, the problem here is patient knowledge. We are unable to control it, and depending on the patient knowledge, right, it can cause some more problems. Now, you also have self-medications, right? Again, patients will take medications and it may not be appropriate for whatever it is that they have. Sometimes it can cause some drug interactions. Again, once you learn more about drugs, there's so many interactions, adverse reactions that a patient can experience. And if somebody's not knowledgeable enough, right, taking certain things, even if it's, let's say, a supplement, not necessarily a drug, it can actually cause some interactions and can cause more problems for the patient. And even though they're over-the-counter medications, some of these medications can still be overused or abused. Again, examples would be your Tylenol, ibuprofen, aspirin, diphenhydramine, which is your Benadryl. Herbal products and dietary supplements. So again, these are very similar to your over-the-counter medication, except for these are not necessarily FDA approved for certain uses. So there are advantages and disadvantages for herbal products or dietary supplements. Advantages would include being readily available. It comes usually from nature, right? So they're usually from herbs, from some plants, from extracts and whatnot. It's often considered natural and preventative. And some people say that they're actually lower cost, but that said, if you look at the market nowadays, some of these herbal products and dietary supplements are actually quite pricey. So it's not always the case, but maybe if you compare it to certain prescription medications that maybe are not approved by insurance, yeah, maybe you can say that it's lower in cost, but nowadays, generally speaking, it's not always the case. Disadvantages of herbal products or dietary supplements include that they are not, because they're not regulated, the formulations can, sometimes they're not consistent. You don't even know what exactly is in that drug because, again, they're not being monitored by the FDA. Sometimes they claim that it's good for, let's say, I don't know, for the blood pressure, but there's really no clinical study. There's really no specific evidence that it actually helps with blood pressure. Sometimes these medications have multiple active chemicals, and again, it's not being regulated. and the strength of the medication, or the supplement, is variable, so sometimes it's not consistent. Some companies actually put like fillers. They don't even have the active ingredient that they're claiming that it's supposed to have. So again, be very careful with this. We need to educate our patient and make sure that they're careful when they're taking dietary supplements. And similar to over-the-counter drugs, this sometimes can be used for self-medication, and it can cause some drug interactions, especially when they're taking other medications, other supplements, or whether they're taking prescription and over-the-counter drugs. Again, they need to have some sort of knowledge, and they still need to report this supplements to their primary care providers or their providers that are giving them prescriptions, because again, what you don't want is to cause some interactions. Now, examples of dietary supplements or herbal products include St. John's wort. So this is often used for anxiety and depression. Black cohosh, which is used for hormonal imbalances, usually used for what do you call this? For menopausal symptoms. Ginkgo for alertness. Red yeast rice is used for cholesterol. So palmetto is used for prostate issues. And so again, these are the classifications of drugs. Some prescriptions, they end up becoming over-the-counter drugs, and regardless whether it's prescription, it's over-the-counter, or herbal medication, we as nurses, we need to check and make sure we're getting a thorough history, and make sure you're specifically asking the patients what they're taking. So don't just ask them what medications you're taking. Make sure that you verbalize what prescribed over-the-counter medications are you taking, and what supplements are you taking, because sometimes if you don't specifically ask for the supplements, they may not even report that they're taking any supplements. And again, we need to know that, because some of these drugs and supplements can have interactions and can cause more problems to our patients. Mechanism of action. So these are basically the actions that the drugs are producing. So these are the therapeutic effects, and it happens in several ways. And so mechanism of action describes the characteristics or how this drug works. So the effects of a particular drug depends on the characteristics of the cell or tissue targeted by the drug. So once the drug is at the site of action, it can be modified, whether it can increase or decrease the rate at which the cell or tissue functions, and it can modify the strength of function of that cell or tissue. Now, terminologies that you have to remember, right? You have to remember the mechanism of action. What's an agonist, partial agonist, and antagonist? So an agonist is basically when a drug binds to the receptor, it causes a response. So it stimulates a response. Now, partial agonist, this happens when a drug binds to the receptor and the response is not as strong. It's quite diminished compared to when it's elicited by an agonist. Now, antagonist, right, the contrary of an agonist, this happens, or this is a type of drugs wherein the drug binds to the receptor and then there's no response. So it inhibits or prevents the binding of the agonist, or it prevents that response from happening. So again, remember this terminology and know the differences between the three and what a mechanism of action means. So mechanism of action, generally speaking, is basically how the drug works. Anyhow, drug concentration. So drug concentration is the strength, the concentration, the amount of drug, right, that's in the system. Now, renal function, hepatic function, and other things can influence the drug concentration. So renal function is the kidney function, right? So if you have a patient whose kidneys are not working well, and we know that the kidneys are responsible for filtering substances, then we may end up with a higher concentration of drug. Now, hepatic function can also affect drug concentration. How it does that is because the hepatic function or the liver function, so the liver functions more it helps metabolize certain drugs. So it basically converts drugs into its active and inactive components. So depending on the medication and the patient's response to it, it may cause a decrease in drug concentration. And sometimes, depending on the drug, it may cause an increase of drug concentration. And again, so that's why we have to check our kidney function and liver function when it comes to administering certain medications. Now, other drugs can cause an interaction and can change the drug concentration in a patient's system or blood. Now, there are also food interactions. So some food may actually increase or decrease the concentration of certain drugs. Another terminology that you guys have to remember is pharmacokinetics. So what is pharmacokinetics? So this is the study of what happens to the drug from the time it is put into the body until the parent drug and all its metabolites have left the body. So this is the study of the movement, like what's going on with the drug at a particular moment. So in absorption, so this is the movement of the drug to the site of administration into the bloodstream. Distribution, on the other hand, is the movement of the drug from the bloodstream to the site of action. Now, metabolism, on the other hand, is basically when the drug changes to its active or less active metabolite. And something that you have to remember, underline it, highlight it, put a star next to it. But anyway, the organ that's mostly responsible for metabolism is the liver. So again, if you see a question that's asking for what organ is responsible for metabolism, that would be the liver. Last but not the least is excretion. So excretion is basically the movement of the drug or the elimination of the drug outside the body. So the organ that's most responsible for excretion are the kidneys. So again, remember that the kidneys are the organs that are responsible for excretion. Another terminology that you have to remember is half-life. So in pharmacokinetics, half-life is basically the time required for half of an administered dose of drug to be eliminated by the body, or the time it takes for the blood levels of a drug to be reduced by half or 50%. This is also called elimination half-life. So typically, drugs are mostly completely eliminated after about 5 half-lives. So at that time, approximately 97% of the drug should have been eliminated. So an example of this, or how you can basically understand half-life better is this. So a drug's highest concentration is 100 milligrams per liters, and in 8 hours, right, starting from 100 milligrams, so that's the concentration. After 8 hours, it goes down to 50 milligrams, which is half of what the initial highest concentration was. Then we can say that the drug's half-life is actually 8 hours. So when we're talking about half-life, this is time. So we're talking about time, meaning hours, minutes, depending on the drug, right? Weeks. So that's half-life. Please know and understand what half-life is. As mentioned earlier, there are certain things that can cause the changes in drug concentration in the body. In addition to that, certain other factors can influence the effectiveness or the interactions of certain drugs. We briefly went over it earlier, but organ function. Organ function is very important because it can actually change drug concentration, and again, it can lead to some adverse reactions. Now, genetics. There are people who are genetically predisposed to getting adverse reactions, and some people, they metabolize drugs or excrete drugs a little differently. Food intake. Some drugs can actually be affected by food intake. Some drugs can actually increase their absorption and concentration with food, and some drugs, it actually does the opposite. There are certain drugs that interacts with other drugs, and again, certain diseases such as kidney problems, liver problems can actually influence the effectiveness and interaction of certain drugs. And again, the route, right? So which route are we administering the drug? So route meaning Is it a PO or something that they need to take by mouth? Is it IM or an injection, right? So the fastest one would be injectable. So usually that would be IV, intravenous, or maybe intramuscular. But if you want to compare it to maybe an oral or topical route. So the fastest one to get to where it needs to go, to get to the bloodstream, would be your injectables. Anyhow, another thing that you guys have to understand is the first pass effect. So this is a terminology that we use to describe the effect of the drug once it goes through the digestive system. So this is basically due to the drug passing through the portal system. So as it passes through, it gets metabolized, and it takes a lot longer, and the liver has to metabolize it before it reaches the systemic circulation. So again, when the liver metabolizes a drug, it actually changes some of its active component into inactive metabolite. So this actually can delay, right, the absorption of medication, and at the same time, it can change the concentration of the drugs. So generally speaking, a medication that can be affected by the first pass effect is any medication that will go through the digestive tract. So be careful, because it can be very confusing, because you have some medication that will have to be placed under the tongue. So one would say, well, that's in the mouth. Yes, but the way it works, it gets absorbed locally, right, to the vessels. So it doesn't really necessarily get digested. So again, it needs to be digested. It needs to work with the liver, right? It needs to be metabolized by the liver. So if it doesn't go through the digestive tract, usually that does not get affected by first pass effect. And again, the drugs that are often affected by first pass effect would be your PO medications, sometimes some NG, right, nasogastric tube medications or gastric tube routes can actually can be affected by the first pass effect. Drug interactions. So drug interactions, it can be, so interactions of drug with each other, it can be additive, synergistic, or incompatible. So additive is when two drugs are given in smaller doses and basically have the same effect as one drug. Now, synergistic, on the other hand, it may sound similar, but they're actually different. So this is when two drugs are given and have a greater effect than one of the drugs. So basically, it's more effective, right, than one drug alone. Now, incompatibility, meaning the two drugs given, they don't really have a good effect, or basically it has less effect. It's not as effective as when given independently. Some medications can interact with food, as mentioned earlier. Examples of these are green leafy vegetables interact with warfarin. So basically, green leafy vegetables decreases the warfarin effect, or the effect of the anticoagulant, which is known as blood thinner. Certain dairy products and antibiotics. So some dairy products can actually decrease the effect of antibiotics. And grapefruit juice. So if you have to remember, one of the most commonly asked questions would be pertaining grapefruit juice. So grapefruit juice actually has so many drug interactions. So it is actually recommended that, if patients are on multiple medications, that they just need to avoid drinking grapefruit juice. Anyhow, so grapefruit juice have many drug interactions, such as interactions with amiodarone and statins. Basically, they increase the effect of these drugs, so therefore it can increase the likelihood of adverse reactions. Now, aged cheese and wine interacts with monoamine oxidase inhibitors. It can cause hypertensive crisis. So this is it for now. Hopefully this helps.